Let's talk about the use of botulinum toxin in the treatment of essential tremor. My name is Dr. Joseph Jankovic, and I have been studying, treating, and teaching about neurology and movement disorders for more than 30 years. Today's topic is going to be the treatment of essential tremor with botulinum toxin. Before I specifically discuss this treatment modality, it is important to point out that developing therapies for essential tremor has been a challenging task. In order to assess any effect of therapy, one has to develop accurate and valid measures of tremor. Tremors may vary due to a variety of factors from time to time because of stress, activity, medications, positions, and a number of other factors. So in order to assess therapeutic efficacy, it is absolutely essential that we develop reliable clinical rating scales and validated objective instruments. One of the instruments that is being used is the Essential Tremor Rating Assessment Scale, sometimes referred to as TETRAS. This clinical instrument has been developed by the Tremor Research Group, and it encompasses a variety of measures that will indicate the severity of the tremor, chiefly based on the amplitude of the tremor. In utilizing this TETRAS scale, we assess different parts of the body, such as the head, face, tongue, voice, upper limb. We also look at the low limb. We ask the patients to draw spirals. We ask them to write. We ask them to approximate a dot on the pen and see how difficult it is for them to approximate the dot. We ask them to stand, and we assess these various body parts on a 1 to 4 rating scale, 1 being barely visible and 4 referring to a very severe high amplitude tremor. Now, tremor varies during the course of the day from minute to hour, and it is important to take that into account so that the variability of the tremor has to be assessed over a period of time in order to ascertain the efficacy of the therapeutic intervention. One of the ways that we can measure tremor over a period of time is to use a portable wireless system called kinesia. In this system, we ask individuals to outstretch their arms, and then we measure the amplitude of the tremor by this computer-generated mechanism. On this slide, for example, we see that the amplitude of the tremor correlates very nicely with the TETRAS scale that I just described earlier. So one can see that in this patient, the overall TETRAS score is 1.5, and the amplitude of the tremor as recorded by the kinesia system is very small, whereas in a subject that has a much higher amplitude tremor, rated 3.5, the amplitude is greater as recorded by kinesia. In another study, we actually showed that over a period of 6 hours, there is anywhere from 18 to 23% variation in partial tremor amplitude as recorded by the kinesia system. Now let's turn our attention to botulinum toxin. Botulinum toxin is a complex molecule that is now being used in a variety of disorders and by multiple disciplines. Our knowledge of botulinum toxin has increased dramatically in terms of understanding the basic science mechanisms, and we now can apply that knowledge to the treatment of a variety of movement disorders, otolaryngological disorders, treatment of spasticity, urological disorders, gastroenterology, and botulinum toxin is used in many other disciplines, including pediatrics, ophthalmology, orthopedics, dermatology, as well as in aesthetics and plastic surgery to remove wrinkles and provide other cosmetic treatments. On this slide, you see the effects of botulinum toxin in the treatment of essential tremor. On the left, the patient draws a spiral before treatment, and 3 weeks after botulinum toxin treatment, you can see that the tremor that is involved in drawing of the spiral has almost completely resolved. One can follow the effects of botulinum toxin in patients with essential tremor over a period of several days or weeks. So in this patient, over 150 days, you can see the gradual change in the tremor. Initially at baseline, at day 0, the patient clearly has difficulties drawing the spiral, and with the treatment of botulinum toxin, there is a gradual improvement of the spiral, which persists all the way through the first 3 months, and you can see that on the 90th day, there is already some recurrence of the tremor, which becomes worse on day 120, and even more severe tremor is noted on day 150. One can also record the effects of botulinum toxin with electromyography, or EMG. On the left, you can see a large amplitude of the rhythmical discharges associated with tremor in the arm before botulinum toxin treatment, and on the right, you can see the marked reduction in the amplitude of the tremor after botulinum toxin treatment. Another way to measure the efficacy of botulinum toxin is through accelerometry. In this study, which was a double-blind, placebo-controlled study, where some patients received botulinum toxin and other patients received placebo, you can see in the orange there is a reduction in the amplitude of the tremor as measured by the accelerometry in those patients receiving botulinum toxin compared to those who received placebo, as indicated in the gray or bluish line. A variety of tremor rating scales also correlate with the improvement in amplitude of the tremor from baseline, as illustrated on this slide. So there is a marked improvement in postural, kinetic, and composite score, as shown by the orange bar, compared to the effect of placebo in patients with essential tremor. Botulinum toxin has been assessed in many clinical trials, and recently the American Academy of Neurology requested that the Therapeutics and Technology Assessment Subcommittee review the evidence-based data and summarize it in this document published in Neurology in 2008. In this document, we clearly showed that botulinum toxin is very effective in the treatment of a variety of movement disorders, including cervical dystonia, blepharospasm, focal limb dystonia, laryngeal dystonia, hemifacial spasm, and tics, and also in essential tremor involving the upper extremity. Now, because up to that point only 2 trials utilized placebo-controlled design, we were able to assign only level B recommendation to this treatment modality. With future double-blind placebo-controlled trials, it is likely that the benefits can be substantiated and that higher level of recommendation can be offered in future evidence-based reviews. In the 2 clinical trials that were reviewed in this evidence-based document, the patients with essential tremor were injected with botulinum toxin into flexor carpi radialis and flexor carpi ulnaris, 2 muscles in the flexor part of the forearm, but they were also injected in the extensor muscles. It is the effect of the injection in the extensor muscle that was thought to cause weakness of the fingers of the hand, and was the reason why only level B recommendation could be afforded to botulinum toxin in the treatment of essential tremor. We have since modified our approach, and we no longer inject the extensors and currently only inject the flexor carpi radialis and ulnaris, and no longer see any evidence of weakness in the extensor muscles. So as a result of this adjustment in our injection technique, the benefits on essential tremor from botulinum toxin have markedly improved, and side effects have essentially disappeared. So on this last slide, I provide a guideline for the treatment of essential tremor. If the patient has an established diagnosis of essential tremor, we provide education to the patient and the family about the tremor and also emphasize the genetic aspects of essential tremor. If the patient does not require any particular therapy, then that's all we offer to the patients. We perhaps discuss with them that stress and other factors may exacerbate tremor and educate them about the nature of the tremor. The vast majority of our patients, of course, do require symptomatic treatment. We may discuss with them the possibility of using small amounts of alcohol prior to an important engagement, but at the same time caution them about the potential risks of alcohol. Propranolol 20 to 80 milligrams may be also useful as a medication that may be used prophylactically to reduce the effects of stress on tremor. Again, vast majority of our patients require more aggressive pharmacologic therapy, and primidone and propranolol are the two medications that are used most frequently. If the tremor is still not controlled with the combination of primidone and propranolol, the patients may require benzodiazepines, gabapentin, sodium oxybate, topiramate, or zonisamide as ancillary medical treatments. If patients fail to respond to medical therapy using these various medications, then botulinum toxin injection might be a useful alternative before the patient is referred for surgery, namely thalamic deep brain stimulation. I hope that I have been able to provide you with some useful information on how botulinum toxin can fit into a treatment program for essential tremor. We hope that you enjoyed the program, and thank you for watching.